Welcome back to Studio 701. Now, along with COVID concerns, it is that time of year, of course, where we are trying to avoid getting sick of any kind, but especially the flu right now. And doctors do say the flu vaccine is a very effective way to make sure that we don't get the flu. And joining us now, Dr. Emily Shea is here for our well-being segment to talk with us about that very issue.
Now, Emily, you are an infectious disease critical care doctor at CHI St. Alexis Health. Influenza and COVID symptoms are very similar, each with some serious deadly complications. How can people tell the difference? Can you explain this to us?
So it's difficult to tell the difference because they do feel very similar. I think probably the one difference between COVID and influenza is the loss of taste or smell. Not everybody experiences that. I think most people will experience the symptoms that more or less overlap. So the muscle aches, the profound fatigue, the fever, cough, runny nose, sore throat, those are the ones that I think most people experience. So it is difficult just based on symptoms to be able to differentiate between the two.
Absolutely. There we have some differences between urgent care and emergency room. Can you kind of walk us through the difference there and where we should go between urgent care or in an emergency room?
Sure. So if your symptoms are more minor, then you'd most likely be able to handle those at home. So things like fever, being very fatigued, we, usually say, stay hydrated, eat as much as you can, rest. If your symptoms become a little more than what you can handle at home, then that would be the time when you need to either call up a physician and say, hey, this is what I'm feeling. Do I need to come in and see you, or do you think that I need to go to the ER? And absolutely, if you're having things like chest pain or, you're feeling very short of breath, that's definitely a reason to not wait at home. Definitely try and get into the emergency room.
Absolutely. Now, do you guys offer, when you talk about, calling up a physician, do you offer a virtual option for patients who may not want to come in right away?
Yes, we do. I think, again, picking up the phone and just making a phone call and saying, hey, this is what I'm experiencing, and then the front desk staff or the physician could even get on the phone with you, or if you have like FaceTime capability, they'd be able to get on that with you and kind of see, what the next step should be. Is it something that they think you'd be able to handle at home, or do they think maybe you do need to come into the office or go to the ER a little bit more urgently?
And Dr. Shea, what can we do to protect ourselves from both the flu and COVID right now?
Great question. So the usual things that we would normally say standard precautions. So washing your hands, being really good about sanitation type of thing would be, I think, the most important thing with regards to prevention. And then obviously getting your flu shot, right? It helps protect not only you, but also the people who you're in close contact with. So either people you work with, people you go to school with, for someone like me, my patients, it'll protect me and them, because should I get sick, it kind of decreases the probability that I'll be able to pass it on to them. And that's, again, if I should get sick. So just, the usual things, especially if you're in one of those higher risk groups, so someone with cardiovascular disease, diabetes, things like that. Pregnant women, these are people who we consider to be in higher risk groups, who we would definitely recommend the flu shot for.
Now, if someone hasn't got the flu shot, where can they get the flu vaccination?
Many of the community pharmacies, with regards to CHI, our Mandan Pharmacy and our community pharmacy, which is located within the hospital. Also, our urgent care and family clinics will also provide the flu shot. And if you have a family physician, they would definitely, and again, if you're, for pregnant women, your OB-GYN's office, I think usually all these physicians' offices would provide the flu shot.
Well, thank you so much, Dr. Emily Shea. Some great information for all of us. Thank you so much for being here.
Thank you.
All right, this has been Well-Being, and coming up next, we have more well-being on the way. Tips